Hello, hello, hello. Welcome, welcome, welcome. Come in, come in, come in. This is Tamika's Den. I am Tamika. Get on in here, y'all. Get on in here, okay? You are now in the den. Kick off your shoes and relax your feet. First and foremost, this is Self-Care Saturday, y'all. Happy Saturday to y'all, okay? And I want to check in before we do anything else, okay? I am still here. You still here. We still here. Go us, okay? Because some did not make it through this week. We are going to inhale that confidence, exhale that doubt, right? And we are always looking to take care of that most important thing as we go ahead and prepare for this next week, all right, or next day. And that most important thing is YOU, all caps, point blank, period, right? That's always what we want to do. And so, of course, y'all know with my self-care Saturdays, I'm bringing awareness. I'm doing positive affirmations. We giving self-care ideas. You know, we are stopping the stigma when it comes to mental health. We are bringing awareness to mental health. We are breaking the silence. And, you know, I really had chronic illness on my mind heavy, you guys. I wanted to go ahead and get into that in terms of, you know, there are many diseases, illnesses, and injuries that cause people to have chronic pain. And if you're in pain all the time, you ain't the happiest person, okay? And if you are somebody that suffers with some type of chronic pain, you are very aware of this, right? And if you are somebody that takes care of somebody that lives with chronic pain, it can also be hard on you too. It's not just the person that's actually suffering that feels it. It is those that are caregivers that can get really stressed out and drained with taking care of people as well. Now, originally, I was going to focus on just chronic pain, you know, giving some examples of different illnesses and diseases that cause people chronic pain. One being fibromyalgia, which I also do suffer with, right? And I wanted to bring awareness to that. However, I'm going to pause that one because y'all know how it goes sometimes, right? Something else hits me and I'm like, I got to do this one first, right? But this kind of coincides and runs, you know, the same thing. A little similar, a little different. So that may end up being a part two. But what we are going to shine a light on and talk about today and bring awareness to is sickle cell anemia. You see that I'm in red and I'm in red and my walls is red too, okay? So red, red, red. Because sickle cell is, you know, you go red for sickle cell, right? This is Sickle Cell Awareness Month. When we are in September, that's Sickle Cell Awareness Month. So, you know, like purple is domestic violence, pink for breast cancer, you know, green for mental health, right? Red is sickle cell. And so for anyone that is not aware about sickle cell, hopefully this will be, you know, educational for you. You will learn something new, right? And for anyone that does know about it, we are just continuing to spread awareness, shine a light, and talk about how important that it is. It affects me personally because I have sickle cell anemia trait. I have people in my family with the trait. I have people in my family with the disease. This has always been something that's important to me, that I wrote papers on in school, that I've studied, you know, both being in the medical field and just personally. And so that is what we're going to do today, guys, right? Just talk about how it is, what it is. First and foremost, let me start out by saying that sickle cell affects about 100,000 people in the United States, you know, and it is mostly people of African descent. We make up 90% of people in the U.S. that suffer with sickle cell disease, right? It also affects Hispanic people, you know, Middle Eastern, Asian, and Indian ancestry the most. We are the highest people that, you know, unfortunately get this illness. And so people with sickle cell and anemia inherit this disease from their biological parents, right? And it can be where one mutated, that's what they call it, y'all, okay, gene from one biological parent basically gives you the trait, right? So sometimes you have two people that have the trait, and this is why we got to have conversations and we got to know what's the history in each other's families, right? Because my mother has 4 kids and 3 of us have the trait and 1 has the disease. So not all the time will your child necessarily get the disease, but it can be a bigger chance if it's 2 of you with the trait. If it's 1 with the trait, then it still could end up being, you know, 1 person that has the trait, right? And so if it's two, then it can possibly be a bigger chance that more than likely your child could end up with it, right? It's not absolutely 100% for sure. And babies are born with sickle cell anemia usually do not even get symptoms for several months, okay? And they may have jaundice, they may have spleen damage, or it could affect their immune system. They could end up with a whole bunch of bacterial infections and things like that. So that's things we got to be aware of and we got to look out for. Now, what sickle cell anemia is, right? And sickle cell anemia, aka sickle cell disease, it can be called that sometimes, right? Is basically it's a group of disorders that cause cells to become misshaped or break down, right? The blood cells have a sickle shape, okay, instead of a circle shape like most healthy blood cells have, right? And so, or it can also be like a banana shape, right? Which hence is why it's called sickle cell. And basically, these cells die early, leaving a shortage of healthy blood cells, right? And it can cause a block, right? Where the blood is flowing, which causes the person that has sickle cell to then be in pain. So basically, the sickle cells are stiff and sticky, right? And they don't move freely through the blood vessels. So they basically end up having a pileup, right? Think about a traffic jam, right? And so let's just say in this area right here is where my blood piled up at. Then this is where I'm going to have the pain at, right? I'm going to get very bad, excruciating pain more than likely in this area because all the blood is not able to flow the way that it's supposed to, right? And it keeps healthy blood cells from basically carrying oxygen to and from where they're supposed to go, y'all, okay? And it prevents the organs from getting the blood that they need, right? The oxygen that they need. And so therefore, this is when you would say that a person is having a sickle cell crisis, right? And this more than likely would probably end up with them having to go to the hospital. So now there is no cure for sickle cell disease, right? Some of the treatments that we have for them is of course, medications, right? Blood transfusions. Some people need bone marrow transplants, and there has been things with stem cell done as well, right? And I've heard things about like umbilical cords when there's a newborn baby being able to be a big help to people that are sickle cell that have sickle cell anemia, right? And so they do suffer with chronic pain, right? Fatigue, pains in their joint, their chest. They can get inflamed. They have, in their fingers and their toes, their legs, they have dizziness. Of course, there's a low oxygen in the body, right? And this all can cause also shortness of breath. And so it's very hard, especially when there's a little baby that can't talk, can't tell you what's going on. I remember my sister when she was younger, us going to the emergency room with her and her just crying and crying and crying and crying and crying. And you know how helpless you feel when your child, just falls or hurt themselves in general or whatever, right? Or if you just have a family member, somebody you care about, your loved one that's in pain and you feel helpless and you feel like you can't really do nothing for them and take away their pain. Just imagine that happening on a regular basis where, you're all the time worried. And then, of course, you get into other worries because the medications that a sickle cell patient has to take are very heavy medications, right? And so it becomes, can they get addicted to this? Can this hurt them? Can they OD from it? And that becomes a whole nother issue, right? And just like I said, being a caregiver to someone who is sick that you're constantly running to the hospital with, that could have an impact on you too, just feeling helpless and feeling like you can't help them, you can't take away their pain. And so you feel it from both ends, right? And I'm somebody that has been a caregiver to people that are sick, and I also have been a person that has been sick myself. So I definitely understand it from both aspects, right? And of course, just like with any other illnesses or diseases, there are certain things that you can do that will make it worse, and there's certain things you can do that can make it better, right? A big impact for people that have sickle cell anemia is them drinking plenty of fluids, them having a lot of water, them trying to prevent dehydration, because we've already are establishing that we have a problem with oxygen, right? And so we want to be doing that. Having a balanced diet, eating a lot of vegetables, eating a lot of green vegetables is very important, right? And if you're a person that doesn't like vegetables, then of course that could become, an issue. And not everybody's situation is the same. Like when we talk about any other physical aspects, when we talking about mental illness, we always have to remember that everybody's situation is different. You can be diagnosed with the same thing, but it can affect you completely different. You're going to have some people that could have it more worse. They may have had to have more surgeries. They may have had to have more blood infusions, transfusions. They may be some that are in wheelchairs and some that are walking with a cane. I've seen all different kind of different people with different situations with it, right? And unfortunately, some people are very ignorant to it and don't know that much about it. And even doctors that so-called specialize in it can be very ignorant in it, right? Have very bad bedside manners, be very judgmental, and just assume and put everybody in one box and be like, oh, wait, you're a sickle cell patient? Oh, well, you're just trying to come in here to get this medication. Oh, no, you can't be a sickle cell patient because you're this age and they're not supposed to live by that age. I worked with them for this amount of years, and all the ones I know that age is dead. And it's like, really, that's what you want to tell a person that's coming into you for treatment? I have seen this, guys, and it is really cringeworthy, right? Because years ago, they didn't have as much information as they have now, right? Things have improved. Things have changed. I can remember that when my mother first brought my little sister home, okay, we were told, like, life expectancy was not that long, right? A lot of times back then, they was telling you that the person would die by the time they was 21. They were supposedly lucky if they lived to see 21. And thank God that she has beat those odds, and she is way, way, way past that now, okay? And so there's a lot of people that actually beat those odds, right? There's a lot more medications, a lot more things that we can do. The oldest person, that living person that's on record that has sickle cell, is actually someone that just passed away recently, named Ernestine Diamond. She was the oldest living person with sickle cell, and she died at 94 years old, okay? So that whole, oh, they not gonna live past their 20s is not really, valid anymore. We're seeing a change in that. And of course, that also comes with, being able to be mentally okay, right? And also physically. It means having your fluids, having the good food and diet, meditation, exercise, yoga, all the same things that really is just what we telling ourselves to do every day, any daggone way, right? But some of us, of course, slip and, may not be on top of it as much or whatever. But it is still just as important for someone with chronic pain, chronic disease, chronic illness, or somebody that is supposed to be, overall healthy, right? It's important for all of us to try to live the best life that we can. But in the person's situation with this, it is definitely extra helpful if you are on top of those things. It does make a difference. You will find yourself not in the hospital as much, not having crisis as much. And like most other things that I talk about when I'm up here with y'all, when they are heavily stressed, this definitely can cause a crisis as well, right? So, and even with me, I have the trait. The trait for me in my records basically say that is a contributing factor to my other illnesses and injuries that I have, right? And with me having fibromyalgia, that is something else, like, and high blood pressure and, different things like that. And so even when I get stressed, I can feel it, right? Where it may start with panic attacks, anxiety attacks, migraines, right? And then it would lead to me having pain in my back, right? Having pain in my body. And so same concept with somebody that has sickle cell anemia. Stress will make you sick, right? I'm always telling you guys it goes hand in hand. If you're mentally sick, it messes with you physically. If you're physically sick, it messes with you mentally. So we have to try to, and I know it's hard. Some days it's easier than other, but we have to try our best to stay on top of it and be aware of that, and monitor it, look at what our triggers are, and try to stay within a certain medium so that we don't end up in a worse situation. We don't end up in the hospital. We don't end up, God forbid, having a heart attack, stroke, and on, so on and so forth, right? And so that is basically what I wanted to tell you guys about. I did not want this month to go out without me shining a light on it. It is something that affects a lot of us, and it's something that I want people to be more aware of. You would be very surprised in this day of age of how many different things people are still very ignorant about, okay, and still don't know all the facts about, and they will just spew out whatever different stuff they feel like doing. So we want to stop all of that, and we want to have the correct information out there, and we also just want to tell people how they can manage, what they could do to help, how they could be a support system. Not only you supporting a person that has any type of chronic pain, chronic illness, right, but you even having that support system for yourself, because like I said, it can get hard on you as the person that's being the caregiver for somebody as well, right? It can be very draining, very tiring, very frustrating. Maybe you have a person that's, going off on you because they're in a bad mood and they're in pain, and they're like, basically using you as a daggone punching bag. So you kind of need that time out, that relax, release for yourself too. And you also need to be able to then give them grace and give them understanding that this is kind of hard on them right now, right? Because they're the one that's there, that's actually feeling the pain. But you also got to know how to take that time out for yourself and say, okay, now I let you, use me as your little punching bag for a minute, but now I'm going to go out here and I'm going to have some time for myself. Always take care of yourself first, guys. Always, okay? You cannot do anything for anybody else if you have not made sure that you okay first. You're not even going to be able to do it even if you want to, okay? So that is always first and foremost. But let's, help each other, hopefully, right? And guide each other and lift up each other and have grace for each other. Have grace for ourselves and have grace for other people too, because sometimes you never really know what somebody else could be going through, right? And so I just want to end this off with some affirmations, okay? This could be for people that's suffering with pain. It could be for people that's not suffering with pain. See, people that's, taking care of somebody with pain. You know that I always try to give you guys some type of positivity. So first and foremost, I am enough. I am enough. I am enough. I am enough. I am more than enough. Okay. If you are in my presence, you getting some good stuff right here. Okay. And I am doing better than my mind tells me. Sometimes our minds be playing tricks on us, okay? We will think all different kind of negative thoughts. We will be like, I'm not doing enough. I'm not giving enough. I missed this. I didn't do that. Whatever it may be. Listen, you doing the best that you can, and it's okay. Whatever you didn't get done today, do it tomorrow. That's that, right? And, I also will allow myself to get rest when I need it, right? Your body will let you know when you need rest. And if you don't listen, then it might end up sitting your behind down in a different way. So I would suggest you listen. So I allow myself to rest when I need it, right? And my feelings are valid. My feelings are valid. Whatever you feel, that's what you feel. You don't got to explain to nobody. You ain't got to apologize to nobody. They can disagree with you, but that doesn't mean that your feelings are not valid. You get to feel how you feel, okay? And as far as, other people, listen, I am not responsible for another person's toxic behavior. I am not responsible for another person's toxic behavior. That's on them. That ain't on me, right? And then for my people that suffer with pain, my pain does not define me, right? My pain does not define me. And pain can be inevitable, right? In some situations, there's just nothing we could do. There's plenty of times when I go into crisis, right? And I get pain. And I'm like, you know what? This is a part of it. I get pain. At this point, that's just what it is, right? And I do what I have to do to relieve it in the different ways that I know how, right? So pain is inevitable, but suffering is optional. So we don't have to sit there and just be in it and suffer, right? We can use the different tools that we know that we have to relieve our pain as much as we possibly can. And that is basically what I have for you guys today. I hope that this, reached somebody, got out to somebody in some way or form, even if it wasn't exactly with pain, chronic pain, or sickle cell, or whatever the case may be, right? There's other different things that we all deal with and go through every day. And I hope today is a good day. If it's not a good day, I hope tomorrow is a better day. Okay, I hope you guys have a great weekend. Don't forget to relax, relate, release, and breathe. Okay, until next time. Okay, I will talk to you guys later. You make sure that you like, comment, share, subscribe if you are so inclined. Okay, give me a wave. Let me know you came by. Put some things up in the sky. All right, y'all. Till next time. Toodaloo.